SPs, please prepare. Examinees, you may begin your first patient encounter.
Come in.
Hello, Mr. Matthew. I'm Dr. Tanya Sundari. I'm the physician who works with you. It's nice to meet you.
Yes, nice to meet you.
Are you the physician in the room?
Yeah.
Okay, I'm here to ask you a few questions and do the physical examination. Is it okay with you?
Yeah.
May I sit down and write while we talk?
Sure.
Thank you. So, Mr. Matthews, how can I help you today?
I've been hearing voices sometimes, like the last 2 days.
Okay.
Yeah.
I'm sorry for what you have been experiencing. I'll try my best to help you.
Okay.
Okay. And do you know the content of your voices?
No, I can't really hear the voices. I mean, I hear them, but it sounds like distant voices. You know, I can't really understand what you're saying.
And you even see something that unusually that any other people they might haven't seen.
Yeah, sometimes I see some like strange like image or words or something on the walls, but that's I don't really know what it says or anything. I don't know what it is.
Could you be able to understand those images and those writings?
No, I don't have any idea.
Okay. Do you feel you are being controlled by those voices and those images?
No.
Okay. Okay, and before this, do you know how did this start? What might have caused this? Do you have any idea?
No, it's never happened before. I don't know what could have caused it.
Okay. And are these voices or the images asking you to hurt yourself or hurt someone else?
Not that I know of.
Okay.
Yeah, no.
And how do you feel? How is your mood?
Like at work, I've been feeling a little more irritable lately. Just kind of lack of interest and but it's kind of down a little bit lately.
Okay. And have you lost your interest in your activities, daily activities?
Yeah, a little bit.
Do you enjoy your hobbies anymore?
I mean, no, not as much.
Okay. Do you have any feeling of guilt?
No.
Okay. Are you able to concentrate on anything you do?
Yeah, normally.
Your concentration is good.
Yeah.
Have you observed any retardation in your activity?
No, I don't think so.
Okay. Now, do you feel thirsty?
No.
No. Okay. Have you had any family? Did anyone in your family have any history of mental illness?
No mental illness.
Okay. And is this the first time you're having this, or did you have it any time before?
Just I've had it just in the past 2 days. Yeah, but before then, no.
You never had it. Okay. May I ask you a few questions about your health in general?
Okay.
I can get some clues to make a proper diagnosis, okay?
Okay.
Do you have any recent infections?
No.
No? Okay, have you had any changes in your weight recently, any weight loss or weight gain?
Maybe a little weight loss.
Weight loss, okay.
Maybe a little.
Can you tell me exactly how much you do?
No, I haven't really checked.
Okay.
Yeah.
How's your appetite?
It's pretty good.
Okay. And do you follow any specific diet?
No.
Do you exercise?
Not really.
Okay. Have you been under any kind of stress recently?
Yeah, a little bit. Actually going through a divorce right now.
I'm sorry to hear.
Yeah, this past week's been pretty rough.
I'm sorry to hear about that.
Thanks.
Did you have any trauma to your head?
No.
Did you have any changes in your urination recently?
No.
Any changes in your bowel movements?
No.
Okay. May I ask you a few questions about your past medical history? Is it okay?
Sure.
Have you been diagnosed with any medical condition in the past?
No.
Okay. And did you have any? You didn't have any similar complaints, right?
No.
Okay. And are you taking any medications now?
No medications.
Okay. May I ask you a few questions about your family's medical
Sure,
conditions?
sure.
Can you tell me more about your family's medical condition?
Well, everyone's pretty good except for my mom has some sort of thyroid problem, but I'm not really sure what it is.
Do you know, is it a hyperfunctioning thyroid or
I want to say hyper, but I'm not positive.
okay. And may I ask you a few personal questions? I want to assure you whatever we discuss is going to be completely confidential. Is it okay?
Yeah.
Do you use any tobacco products?
No.
Do you drink alcohol?
No.
Okay. And do you use any illicit drugs?
I do marijuana sometimes, and sometimes at parties my friend gives me a pill, but I'm not really sure what it is.
Okay. And when was the last time you took your marijuana?
Marijuana, it's been several days, but I had the pill like 2 days ago.
Okay. And you don't know what the pill is?
No, I'm not sure what it is.
Okay. And do you have any headaches?
No.
Any changes in your vision?
Not other than the moments when I see
apart from-
something.
I mean, like, are you able to see blurry vision?
Oh, yeah, I can see good.
Okay.
Yeah.
Okay. And do you feel cold while others in the room feel comfortable?
No.
Okay. Did you notice any changes in your skin or hair recently?
No.
So, Mr. Matthews, based on the information you have given me, you said you lose your voices since 2 days and you don't understand the content of those voices and you also see some images.
Yeah.
Okay. And you have been going under stress recently and you also took some drugs recently
Yeah.
and you are not sure what it is. Okay.
Yeah.
Is it right?
Yes.
Okay. Do you want to add something to this?
No, I can't think of anything.
Okay. So, based on this information, I would like to do the physical examination. Is it okay with you?
Yeah, sure.
Please allow me to wash my hands. Do you have any questions or concerns for me?
No, not that I can think of right now.
So, first I would like to examine your head.
Okay.
And I would like to look into your eyes. I would like to splash some light into your eyes. Is it
Okay.
Can you please look straight at me? Okay. Now I would like to, can you please follow my finger
Sure.
without moving your hand? Yes, now I would like to examine for the thyroid gland in your neck.
Okay.
I would like you to swallow. Okay?
Okay.
Can you swallow for me? Thank you. Now, and I would like to check for the, do some short neurological examination.
Okay.
For that, I have to ask you a few questions, and
Okay.
those may be a bit silly for you, but I need to ask those to get some clues to the diagnosis. Okay? what day is today?
Today is the 31st, May 31st.
Okay. And where are we now?
We're in the hospital.
And can
There
you
are
please
5
tell me your
minutes
name?
remaining. if this
Robert
patient
Matthews.
Okay. And now I'm going to say you 3 words. Can you please remember these words for me? Cat, pen, and moon.
Cat,
Pen.
pen, and moon.
Yeah.
Okay.
Could you please remember these 3 words for me?
Okay.
Okay. And can you spell the word world backwards for me?
World,
Yeah.
D-L-R-O-W.
Yeah, very good. Okay. Now can you please repeat with me or no ifs, ands, or buts?
No ifs, ands, or buts.
Okay, very good. Can you please repeat those 3 words I just asked you to remember?
Cat, pen, and moon.
Okay. Can you please read this sentence for me?
Close your eyes.
Can you please follow the sentence? Okay, thank you. So now, I would like to examine to the cranial nerves.
Okay.
Can you please tell me how many fingers are these?
4.
Okay. And now, I'm going to just touch on your face with this. I would like to let you know that this is sharp.
Okay.
And this is sharp.
Okay.
Can you please close your eyes and tell me what you feel?
Dull. Dull. Sharp. Dull. Dull. Dull.
Now, can you please raise your eyebrows? Can you close your eyes tight? Can you blow your cheeks? Can you stick out your tongue and move it side by side? Okay. Can you please shrug your shoulders against my hands? Okay. Can you please step down and walk a few steps for me?
Sure.
I got the break for you.
Thanks.
Okay. Please step back. Thank you. Now I would like to check for the reflexes, okay?
Okay.
Sorry.
It's okay.
Can I lift up your head?
Sure.
So Mr. Naik, please, I'm done with my physical examination and thank you for letting me do the physical exam, okay? And based on the information you have given me in the physical examination findings, the reason for you hearing voices could be due to the drugs I have taken recently. These may cause you hallucinations, seeing something unusual or hearing something unusual, or it might also be due to some stress you are undergoing
Okay.
recently, or it could also be due to some abnormal function of your thyroid.
Okay.
Okay, so based on these things, I would like to do some tests, check for the levels of thyroid, and do a mental examination on you. I did just a brief one, and we need to do it in detail.
Okay.
Okay, and once I get back the test results, I'll be able to make an accurate diagnosis and give it appropriate treatment.
Okay.
I would also like to do some imaging studies of your life. Okay.
Okay.
Do you have any questions or concerns for me?
Well, you don't think like I'm, going crazy, like schizophrenia or something like that, do you?
Schizophrenia, it usually happens when you have these symptoms for like 6 months and then you just have it for a brief time now. So for now, I can't say whether it is schizophrenia or maybe it can also be due to the drugs you are using.
Okay.
So I'll take some time. For now, I can't say accurately whether you have schizophrenia, okay?
Okay.
And once I get back the test results, I'll be able to give you the accurate diagnosis, okay?
Okay.
Did I answer your question?
Yes.
Okay. It was nice meeting you.
Alright,
Thank
nice
you for
meeting
your cooperation.
Thank
Have a
you.
good day.
You too.
Bye.